Welcome back to my channel. It is Majestically Maya. Today's video is going to be very informative, but if you are someone that has a weak stomach, just know that this is a disclaimer that when I'm talking about the fibroids and when I'm talking about the subchorionic hemorrhage, that I am going to include photos. I definitely am going to do the best that I can to include timestamps so that you can jump past whatever you don't want to see. But if you are somebody that's interested and you are curious to know about how fibroids can impact your fertility, and if you're somebody that's potentially going to have a myomectomy, then I'm going to share my experience so that you know what to expect. Before we begin, you're probably wondering, what in the world are those things? It is a non-cancerous tumor, also known as a myoma. So it's a growth that is in your uterus or somewhere within the uterine wall, and it typically occurs during the reproductive years of a woman's life. These are benign tumors. They are non-cancerous tumors. Uterine fibroids can be located in a few different locations, including within the muscular wall, bulging into the uterine cavity, or on the outside of the uterus. Depending on where the fibroid is located, it can also be attached to a stem or a stalk. I did experience symptoms from my fibroids, but I did not know that I had more than one, which I'll talk about later on. When I was younger and I knew that I was wanting to find a husband and have children and just start that part of my life, my family member, and I'm not going to identify the person, but my family member was struggling with uterine fibroids and had to have a myomectomy to remove them. I took it upon myself to go to a specialist to see if I myself had fibroids, and I was informed that, and this was in my mid-20s, I'm 31 now. So during this time period, I was informed that I had one fibroid and I did not have to worry about my fertility or anything else. So I thought I was good to go. So fast forward to life. I didn't realize that when I had my menstrual period that they were heavier than normal. That was just my way of life, and I thought that it was just like a genetic thing, that maybe myself and other ladies that I knew in my family just had heavy periods. But I knew I had that one fibroid, but I was not concerned because it was just a way of life. Okay, so some of my symptoms from fibroids range from let's see, I wrote a list of things so I can be very specific with you guys. So heavy periods, I did have fatigue, but I was accustomed to it and I was just taking a nap. Okay, anemia was a big one because there were plenty of times where my iron was low, and that just leads to a whole nother set of symptoms, right? So when you have anemia, it means that your iron is low, but it also means that you have low red blood cells. Because of my anemia, I would experience being cold very often. Other symptoms include excessive fatigue and loss of energy, dizziness, unusually rapid heartbeat, shortness of breath, cold hands and feet, pale or yellow skin, chest pains, and headaches. And after my yearly check, I remember them saying everything looks great, but I remember seeing that my red blood cells were low, and I was very curious to know why in the world were they low. And I feel like I didn't really get an explanation, but now I know it's because of the excessive bleeding due to the fibroid. I think it's a little silly, but I attributed my bloating to meeting my husband back when we were dating. I just assumed we were just eating a lot of food and hanging out, and later on just continuing the habit of going out to eat and him cooking or me cooking and just eating more than normal, even though I was still pretty active and doing jujitsu and karate. But I thought that it was just him, and apparently it was probably my fibroids multiplying. Sometimes I would have cramps, and it was outside of my period cramps, even though my period cramps were definitely severe. Now, moving on to when I realized my fibroids were problematic. My husband and I found out that we were expecting a baby, so I was pregnant and we were just enjoying life. We were going to Halloween parties and hanging out with our friends, eating dinner and candy, and going to Christmas parties and enjoying the holiday season and just really enjoying life, preparing for a baby. And then all of a sudden, now here is the disclaimer, because we're moving to the subchorionic hemorrhage. If you are squeamish, tread carefully here, but I'll give another disclaimer before I show the photo. We were just enjoying our lives together, and one day I didn't feel that great, and I think I talked about this in the miscarriage video. I thought that maybe I was peeing on myself, or like I was just really sensitive, but actually my water had broken. I was not bleeding, but by the time we got to my friend's house, I thought that I miscarried. There was a huge clump. Now, here's the disclaimer. I'm going to show the photo. There was a huge clump of tissue that came out, and I thought that that was going to be miscarriage. But it was not. There was a bleed in between the amniotic sac, which is what the baby was in with the fluid, in between that sac and then my uterine wall. A subchorionic hemorrhage is also known as a subchorionic hematoma, and it increases the chances that you are going to miscarry a pregnancy. This means that there is an increased risk of early pregnancy loss. They say that pregnant women with the subchorionic hematoma are 5 times more likely to develop a placental abruption, meaning that the placenta is going to detach from the uterus. And this leads to preterm labor, premature rupture of the membranes, which is what happened to me. That means that your water is breaking early. There can be an early pregnancy loss or even a late pregnancy loss due to this specific complication. It's important to add that having a subchorionic hemorrhage does not mean for sure that you are going to lose your child. It just increases the likelihood of having a complication that results in loss of pregnancy. We went to the ER and they did the ultrasound and told us that the baby was still in there. She still had a heartbeat and everything was not fine, but we still had our baby. So we were okay, but we weren't out of the clear because we were at risk of miscarrying the baby. So that was a very long couple of hours, but they also confirmed that I had multiple fibroids. So previously, my OBGYN told me that they believed that I had about 3 fibroids. I said the specific number in my miscarriage video. I cannot remember verbatim right now. So I thought, okay, since my mid-20s, I had 1. At this point, I have about 3. Maybe they said 4, I don't know. But by the time we had the subchorionic hemorrhage and the threatened miscarriage, the ER confirmed that there were at least 6 fibroids, and we were in for a ride. So after that, I did miscarry. A few weeks later, it was confirmed I had to have a DNC. A DNC is short for a dilation curettage. This is a procedure in which they dilate the cervix so that they can extract the tissue that is inside. As you saw in the miscarriage video, I was essentially in the twilight zone because I never could have imagined being in that situation. and I would say it was a very traumatic time period. Risks of having a DNC include heavy bleeding, infection, perforation of the uterine wall or bowel, and potentially developing scar tissue inside of the uterus. And unfortunately for people like myself, uterine fibroids can cause infertility or pregnancy loss. Risk factors for uterine fibroids include race, family history, and then other factors. Regarding race, Black women are more likely to have fibroids than any other group and at younger ages. In addition to age, we also have larger fibroids with worse symptoms. Family history: if you are someone who has family members that have uterine fibroids, like your mother or your sister, you're probably going to have them as well. Other factors include starting your menstrual period before the age of 10, being obese, having low vitamin D, eating more meat than vegetables and fruit and dairy, etc. Current research suggests that it may be impossible to prevent uterine fibroids. However, if you incorporate healthy lifestyle changes, you may be able to minimize your fibroid risk. And then after that surgery, the doctor went ahead and talked to us about the myomectomy. Now, this is very important because if we want to have children in the future, we definitely would need to have this surgery. Fibroid removal surgery, also known as a myomectomy, can be performed via a laparoscopic, hysteroscopic, or abdominal surgery. In my case, I had an open abdominal surgery, which is essentially a C-section. I had to have an open abdominal myomectomy because my uterine fibroids were too large, which you're going to see later on. But the other two versions of the surgery are less invasive, including the laparoscopic, which is where the fibroids are removed from various incisions, seen here in the second image. And then the third, the hysteroscopic myomectomy, is internal. So if you have fibroids that are within the canal, they can go in to the uterus through the canal and extract your fibroids. I wanted to ensure that I had my favorite meal, seafood boil, and then I wanted the orange creamsicle frosty from Wendy's for dessert, and that was my last meal for that day. Because of that meal, I was content with that being my final day before I was sliced open. Yeah, that was an interesting time. Went in for surgery. My doctor said that when they started to put me under and administer the anesthesia, that I told her, hey, you have to get at least 5. I do not remember saying that, but what I do remember is her telling me, you're not going to remember this conversation. Guys, they got in there and they realized that not only did I have 6 fibroids, but I actually had 11 fibroids, and they were able to remove 9. Okay, I'm going to include another disclaimer because I do have the photo of the fibroids that were removed from my uterus. They were intramural, meaning they were in the muscle, like on the wall. I have one that's in the back of my uterus on the outside, and she said that it was not affecting my health or like not affecting my fertility. And so because I had the open myomectomy, meaning I basically had a C-section, so it would have been risky to try to get that one as well. She told me before the surgery, if there were any that were located in areas that are too close to important veins or my tubes, that she would not jeopardize my life or my fertility, because that was important to us. I still have the fibroid in the back that is not causing much of an issue. And then I still have another fibroid that's near my tube at the base, because she said if she were to remove that one, then it would have caused scar tissue that would have closed the tube and prevented us from being able to use that tube, potentially decreasing our chances of having a child. I suspect that that's the one that's submucosal and pedunculated, because from the ER, one of my fibroids that they detected was pedunculated, but they didn't tell me specifically which one. So I'm just bridging the information from what my doctor, my OB, told me after she sliced me open, and what I knew beforehand from the ER visit during the threatened miscarriage. After surgery, my mouth and my throat were hurting because they struggled with the intubation process, which you'll see here in a letter. My lip was completely busted and my tongue was sore on the side. My gum area beneath that part of my tongue was essentially shredded, okay, because they were really struggling to make sure that I could get some air after they put me on their anesthesia. And my OB said that they were considering just waking me up and canceling my surgery because the inability to intubate. After surgery, I stayed for a few days, and during my time there, they brought breakfast, lunch, and dinner, which I did get to select. However, the cafeteria staff and the medical staff were not in sync, and my meals weren't as healthy as I would expect. I was informed that I needed to avoid foods that increased gas, and this was important because I didn't have a bowel movement until my final day in the hospital. The lack of bowel movement was ongoing even after I returned home, which just added to my bloated abdomen. So after surgery, they're going to give you a wrap for your stomach, the same wrap that they give to mothers after birth. Initially, my stomach was wrapped above my incision, and I continued to do so until my follow-up appointment when my OB informed me of the trick to protect the incision. So she told me to place a pad on top of the incision. So you open the pad, don't remove the outer package so that the sticky side remains covered. But if your pad has wings like mine did, you're going to remove the paper on the flaps before folding them back. And then you just put the pad on top of your incision, and then you're able to wrap your stomach lower so that it covers your stomach and the incision and give you that additional support. While you're recovering in the hospital, they're going to encourage you to use this lung exerciser. It's called the Bloating 4000 volumetric exerciser. You inhale so that you can expand your lungs, and it forces you to utilize your lungs so that you do not develop pneumonia. So after surgery, of course, my friends and family came to visit. My dad and my husband were there. And then after surgery, I had visitors. But you guys, I have to give a shout out to my best friend, because Dr. D.
My name is Dr. Darianne. I'm a physical therapist, and I specialize in treating pelvic floor dysfunctions.
She was one of the first people that made me realize that I can walk a little further than I initially believed. Go follow her, because she'll make sure you know exactly everything that you need to know. This nurse was a pleasure to just have her in my company and to talk to her, because she was very relatable and just very nice. And she said we were kindred spirits. I don't know if she tells all her patients that, but we definitely bonded. And I thought she was funny and just very down to earth. But anyways, the nurse, I mentioned the nurse because she was the first one to tell me, hey, we need to walk a little further. My best friend, she is the one that told me, hey, you can walk, not only can you walk further, but I'm going to tell you about your posture, and this is what I want you to do, and drink this water and do this and do that. And I'm like, yes, Dr. Darianne, like I would totally, like, you got me. Like, I know you got me. She was my maid of honor in my wedding. So like, I completely trust her, and I've known her since we were 5 years old. One aspect of recovery that I want to discuss is the mental toll that it takes on you. Okay. It's going to take a mental toll on you if you, or potentially, I can't speak for you guys, but for me, it definitely did. And it's because for me, I don't even have children. So I miscarried my first child, my first pregnancy ever, anything like that. I miscarried. Then I had to have the D&C. And then knowing that because of my fibroids, my doctor had already informed us that because of my fibroids and because of the threatened miscarriage, I wasn't going to be allowed to carry my child to term. They were going to induce labor in this 8-month, but they assumed that I would have given birth hopefully by the 7th month, if not potentially 6 months, but that would have been really risky and the baby could have died. So I was going to be hospitalized so that I can get as close to the full 8 months as possible. And so mentally, to think that I was praying and trying to will myself to get to that point, and now during that same time frame, I'm not in the hospital to give birth to my child. I'm in the hospital to birth my fibroids that were the cause of restricting the space that my child had to grow. It's really a hard pill to swallow. So for me, like, that was something that I had to stop thinking about, because the timeline, and it still gets me, the timeline to know, like, that's where we would have been. But I will say that this surgery has provided me with the tools to be healthy and have children in the future.
Three weeks out from my surgery, I feel mostly normal, but I still have 3 more weeks until I'm cleared to return to my pre-surgery habits. The skin around the incision feels foreign to my body, but every now and then I also feel like a little twinge of pain when I move, and it's like I'm always aware of my womb, which is something that I had never been mindful of before the pregnancy and all of the things that I've incurred in the last year. I totally never thought about my womb as much as I do now. My doctor wants me to continue taking the iron pills because my blood is still low. And of course, that's a result of the blood loss during surgery. While I had the surgery and recovered for a few weeks, our fur baby was at my mom's house and she was extremely excited to see us. I mean, she basically demanded to return home. So that's why I included this footage, because she's definitely a part of the family and that was a part of this experience. Did you enjoy being here? Okay. Are you ready to go home? Okay, but hey, no, not right now. Macy, we're gonna go home in a second. We're gonna wait till Grandma comes back.
This is my journey with fibroids and the myomectomy. I thank you for watching this video. I definitely hope that this helps you so that you know what to look forward to for yourself or your family member, or even if you're curious. So if you are somebody that is at risk of having fibroids, then you definitely need to go and get yourself checked out.
I debated about whether or not to include my creative endeavors. I'm just going to include one because creative outlets are how I cope and it's the only thing that I can actually control. So yeah, I put the link in the bio.
Thank you. Bye-bye.